mesothelioma, you know what I'm saying. It's still a cancer. The oma tells you it's a cancer. Being the most prevalent types, these cancers typically originate in the bone marrow, the soft tissue at the center of the bones responsible for regenerating stem cells. These stem cells mature into essential blood components: red blood cells that transport oxygen, white blood cells that fight infections, and platelets that aid in blood clotting. Blood cancers primarily arise from the excessive production of abnormal white blood cells, which disrupt normal blood cell generation. That color is just a plague, ain't it? The three main types of blood cancer include leukemia, lymphoma, and myeloma. That's the one that you always hear at night. Leukemia is the most common blood cancer in the U.S. and often presents in childhood, characterized by an abnormal increase in white blood cells that hinders the production of red blood cells and platelets. Lymphoma affects lymphatic systems with two primary forms: Hodgkin and non-Hodgkin lymphoma, each having various subtypes. Myeloma, particularly multiple myeloma, originates in the bone marrow and affects plasma cells responsible for antibody production. Other less common blood cancers include myeloproliferative neoplasm and myelodysplastic syndrome. Dear God, and I'm still better than the president. Felon. Several risk factors can increase the likelihood of developing blood cancer, including age, gender, smoking, exposure to toxic chemicals, previous cancer treatments, and a family history of blood cancer. Symptoms may vary, but often include fatigue, shortness of breath, swollen lymph nodes, and frequent infections, along with specific signs like unusual bruising or unexplained weight loss. Diagnosis typically involves blood tests,